Thank you for joining us today. One of the key things we do at the Medical Society is to bring information on new regulatory requirements and compliance issues to the field. And today we're doing just that. I am pleased to introduce Tom Sullivan, who's going to take us through a presentation here so that you can get firsthand information on the new requirements. The Act takes effect a little over a week from now, and will put new requirements on prescribers with DEA prescribing authority. So Tom is an accomplished leader in both pharmaceutical and continuing education industry. He has over 25 years experience in designing and developing clinically relevant education programs. He currently serves as Senior Vice President at Clinical Care Operations, or Clinical Care Options. Mr. Sullivan spearheads their efforts in association relationships, as he does here with MSNJ. Tom has a great reputation in the industry, largely due to his focus on policy and compliance issues. In addition to his work here, he's the editor and author of the well-regarded website Policy in Medicine, which provides in-depth coverage on regulatory and compliance matters affecting pharma and the device industry. In addition, Tom founded and is the director of the CME Coalition, an advocacy and education organization dedicated to informing policymakers on CME issues. In response to the COVID-19 pandemic, Tom played a pivotal role with us in establishing the COVID-19 State Medical Society Collaborative, consortium of over 30 state medical societies that work together to provide critical information and education on COVID-19 related issues at that terrible time that you all experienced. So with that introduction, I will turn it over to Tom. He's going to take us through some of the requirements, some of the options for you as you look, as we look towards the implementation date of the MAID Act on June 27th. So Tom, take it away.
Well, thank you very much, Larry, for the kind introduction, and we really enjoy working with the Medical Society in New Jersey, and we're going to outline just some of the understanding what the MAID Act is and what was the thought behind it, so give you some background. In addition, we'll look at the MAID Act training requirements, we'll look at the MAT waiver, and we'll also look at some pieces of New Jersey law that you should know, and then what the Medical Society of New Jersey courses that are available. So what about the Medication Access and Training Expansion Act, or the MAID Act? This was passed in the omnibus bill. That was this giant bill that was passed in Congress at the end of the year last year. It's intended to really look at the opioid crisis, but also infrastructure around addiction treatment. What other addictions besides even opioids should we be really concerned with? It's also to equip medical professionals to recognize an addiction, then treat addiction, to standardize access to addiction treatment medications, and training on how to integrate them into your medical practice. What they're finding is that people just weren't, even though these medications were available to treat patients with addiction, there wasn't much education or knowledge in the general medical community around what to do with this issue. It is effective. The MAID Act, or the Medication Expansion and Training Act, is effective as of June 27th this year. So starting anyone that renews their DEA license starting June 27th will have to meet this requirement. It affects all DEA certificate holders except for veterinarians. It's a one-time requirement. It's upon initial registration or renewal of their DEA registration. It applies to 1.9 million DEA certificate holders, of which 56,000 live in New Jersey, and it requires a total of at least 8 hours of training on the management and treatment of patients with opioids or other substance abuse disorders. Now, the MAID Act's primary sponsors were both Democrats and Republicans. This is not this is not just to affect one party or another, as we can see. The primary sponsors, there were none in New Jersey, but know that this was a bipartisan effort to get this passed. This actually had been introduced in probably 5 or 6 different Congresses over the last few years, and this was just one that just made it into that reconciliation package. The goal of the MAID Act, according to Senator Bennett and Collins, is to give you, again, a one-time repetitive, non-repetitive requirement for all DEA office holders. They basically want to level set the playing field to complete training in treating and management patients with opioids and other substance abuse disorder. And understand this is not about, oh, we're writing too many opioids, as much as it is, what do we do with patients that have substance abuse disorder and how do we treat them? It allows accredited medical schools and residency programs and physician's assistant schools and advanced practice nurses to fulfill the training requirements through comprehensive curriculum that meets standards that lay out a statute for having a coordinated to development of their education. And it's also basically to normalize addiction medicine across all professionals, across the whole part of medicine, so that people understand what this is about. I would also say, if you have any questions during this presentation, and I didn't mention this earlier, but if you have any questions, there's a chat box. Go ahead and just enter your questions in the chat box, and we will be looking at that chat and trying to answer as many of your questions as possible. So why substance abuse disorder continuing education? Basically, we've seen in the last few years 3 waves of the opioid crisis. We had wave 1, which started in about 1999, which was a rise in prescription opioid deaths. And that kind of leveled off and actually is quite dropped over the years and kind of remained steady. And there's a lot of things that we've done on the opioid front that has really made a difference as far as prescription opioids, including REMS, including introductions of PDMPs into almost all states. Actually, all 50 now have them. So we've seen that, and that's kind of helped to reduce the number of commonly prescribed opioids over time. In addition, we had the rise in heroin opioid deaths that started in 2010, but I think the real wave that hit was this rise in synthetic opioid deaths, which is fentanyl and tramadol, which is illicit, and this is basically just taken off and run pretty significantly. Now, what we found though was that over the pandemic, actually, one would think, well, maybe we'll have a reduction in opioids because people are getting out less and everything. But I think because people were staying home, they kind of ran out of things to do. So they actually saw an increase in opioid deaths, especially in 2021 and 2022. It's coming back down a little bit, but you can see that basically it's about 50% higher than it was prior to the pandemic. So this is a pretty significant problem. Now, for the state of New Jersey, we can see that basically we didn't see necessarily that same rise in drug deaths over time. By year, it looks like it's been basically the same from 2021, 2022, and then 2023. We see a drop, but that's only because there's a drop in data after May, and it probably will level off. In addition, in New Jersey, we see suspected drug deaths by race. It's about 50% white, about 30% African American, and about 20% Hispanic. And then, but it's mostly affecting the male population of the state. And what's in New Jersey specifically, this is a problem for people in peak working years. So between the ages of 25 and 64 is where we're seeing most of the opioid deaths in the state of New Jersey. And so when you're thinking about your patient population, yes, it does affect pediatric patients, but it really affects those from the 25 to the 64 age range, where the younger patients come in is that help prevent getting into substance abuse disorder at an earlier age. So you'll be able to have those working years to be able to function and be part of have a really good time in life. Now, New Jersey substance abuse admissions have been primarily heroin or opioids, alcohol, marijuana, and then cocaine have been for your substance abuse admissions. And we can see the admissions rates. Counties like Atlantic and Cape May have really high. And then other counties like Bergen and Morris have lower, even though there's some of those counties have significant substance abuse issues. Overall, New Jersey drug statistics, 2,583 people died from opioid overdoses in the last year. Opioids are a factor in 89% of all opioid deaths. 29.5 out of 100,000 residents died from opioid overdoses. That's 100%, about 100% of the national death rate. 67% of hospital births, 0.67% of hospital births have some kind of neonatal withdrawal syndrome. And then we can see that hepatitis C is also pretty prevalent, and that's among the intravenous drug users. So it's a lot of, and then HIV can also be transmitted by intravenous drug use. So by helping to stop substance abuse disorder, you're probably also helping downstream effects of other different diseases. Medicare looked at it, and they also saw that they have a huge issue in Medicare. There's in 2020, 1 million Medicare beneficiaries were diagnosed with opioid use disorder. They've seen, but fewer than 16% of the beneficiaries receive medication. And so they thought that this is not very good. Only 50% of them receiving even behavioral therapy. So they see this as a need that patients understand that physicians and physician assistants and nurse practitioners and others in the field understand what substance abuse disorder is and how to discuss that with your patients. There was a DEA notice that went out on March 27th. Something tells me most of the people here in the room got a copy of it, and that's why you're on this call. And basically, so the DEA sent out a notice. It's going to be a question on your registration. It's going to basically require you to check a box on your registration form. Right now, it's on the registration form, but it says it's optional and it's not, and it says it's coming. But do you hold board of certification in addiction medicine? That's not a huge number of people. I think there's about, if at last I looked at it, it's about 100 in the state of New Jersey. Have you graduated in good standing from an accredited medical school and taken 8 hours of training in management of patients with opioid use or other substance abuse disorders? I think it depends. We had thought that this was, I think SAMHSA and DEA and even Congress thinks that all medical schools have this, but I was on a call with another state about 2 weeks ago, and the dean of that medical school says, no, we're not offering that in our medical school right now. So you do need to check and see that you had this course, that you offered this course at your medical school when you did your training. And have you completed 8 hours of training, either inclusive or incremental? So if you're taking courses that are dealing with this over time in the treatment and management of patients with opioid or other substance abuse disorder. Now, this applies to all DEA practitioners except veterinarians. Physicians who are board certified in addiction medicine, I say, are exempt. Practitioners who graduated from U.S. medical school, I discussed that. And then also another exemption is if you previously took training to meet the requirement for a data waiver to prescribe buprenorphine, that can count towards this 8 hours of training. And in New Jersey, that's about, I think that's about almost 2,000 people in the state of New Jersey have met that requirement. If you've taken the data waiver training or that 8 hour requirement, that does count toward this. So what can count as training? It's 8 hours of management and treatment of opioid or other substance abuse disorder. If it's previously taking courses in substance abuse disorders or the management of dental pain, no longer than about 5 years. We recommend 5 years. That's what the number they gave for the medical schools. It's not clear yet. They haven't come out with exactly what that means. But we're saying it's probably safe to, if it's a course you took in the last 5 years, go ahead and count that. You will be able to count the 1 hour requirement for New Jersey. It's not, but I would say it's a non-repetitive credit. So if you took the same course each of your renewal cycles since 2018 or 2019, when that requirement came in, then you may be able to count both hours if it was a different course. If it was the same course, probably not. Training can be classroom situations, seminars, professional societies, and you also, according to the DEA on a webinar that they did a couple months ago, you really need to have proof of education if you're ever asked about this. Similar requirements for NPs and PAs, practitioners that have completed not fewer of 8 hours in respect to treatment and management of opioid through classroom situation. So it's really the same requirements for NPs and PAs. SAMHSA recommends that the courses include these pieces, which include, and there's a lot of different areas that they ask to be covered. They just came out with this on March 27th, and the course that New Jersey, that we've developed with the state of New Jersey, with New Jersey, the Medical Society of New Jersey, includes this information. So please note that we're covering all these points that SAMHSA has, including how to use naloxone, safe education on that, polysubstance abuse. Usually people who have substance abuse disorder also have multiple substance abuse disorders, or eventually will wind their way there. So understanding it's not just one substance abuse disorder, there's many. We have in our SAMHSA has said to have effective treatment planning, so that what do you do to help with social determinants of health in this area? How do you collaborate with, which is basically access to other services? How do you collaborate with other disciplines? What's the legal and ethical issues involved in the care of patients with substance abuse disorder? You should note, and we're going to talk about the MAT waiver, but because of PDMPs, some of the MAT drugs, especially buprenorphine, is also an opioid. So there's other things, and I'll go into that in a minute here, but there's other things involved. In addition, also covering things of pain management, components of developing effective treatment plans, managing patients with opioid analgesics, including tapering, recognize signs of opioid use disorder in the setting of prescribed opioids. So who can provide the training? There's a whole list of organizations that can provide it. So in addition to the Medical Society of New Jersey, there's a lot of other groups that have education, but we really designed our course toward these requirements that SAMHSA came out with. There is one of the things that people that in the physician community is, you say, well, what about reimbursement for screening, or what do I get for that? Well, there's a piece called Screening for Brief Intervention and Referral. It's screening, brief intervention, and referral, and it basically, there are codes, both commercial, Medicare, and Medicaid codes that you can use for the time you spend. It doesn't, for physicians, most of this can be done through surveys that you give the patients and you review it with them, and then you just discuss it with them. There are other ways in which you can bill for some of your other staff to be able to help with them. So we'll discuss that. And we cover that in our Medical Society of New Jersey DEA course. We have devoted some time in our course to that, so that you know that the government understands, hey, you've got to be reimbursed for your time. And there are ways to do this. This is different than New Jersey law. The New Jersey law is every 2 years. It's 1 hour. It's a 1 hour requirement, and it's 1 hour category 1 concerning prescription opioids, including responsible prescribing practices for opioids and managing, treating pain and the risks and signs of addiction. Note that this course meets the New Jersey requirements. And in addition, there's the course that and actually most courses that you would take in for this requirement would meet this requirement, for the federal requirement would meet this. In addition, that would meet your state requirement. In addition, federal law is a one-time 8 hour requirement on the treatment and management of patients with opioid or other substance abuse disorders. So understand, and then it's for other opioid use disorder. Mainstreaming Addiction Treatment Act is another part that was passed as this law. So if you were using MAT training, addiction treatment, and you're treating patients with buprenorphine, understand that you're no longer on the federal government side. There's no longer restrictions on the number of patients that you can treat. There are, again, about 155,000 license holders that have the X waiver across the U.S. About 4,500 of you in New Jersey. So if you've done this X waiver training, again, you're exempt from having to take the course. There are New Jersey guidelines for buprenorphine prescribing, and those are, and we'll talk about that in a second. But and then again, there's a risk for rapid increasing the number of buprenorphine patients. If, for instance, your PDMP starts to see you double the number of patients that you're giving opioid therapies to, that's gonna make its way down the chain of for regulators to kind of look at your practice. So if you do increase, and we do want you to treat patients with this, you have to go through a REMS to treat it as well, to understand the issues around buprenorphine. This is, but just understand it is an opioid, and it is something that is entered into your PDMP. So if you do increase it slowly over time. The MAT waiver only applies to prescribers of buprenorphine. It had to be verified at the pharmacy levels, and again, this new requirement is for all DEA license holders, not just if you prescribe opioids. It's 8 hours, it's self-reported, and again, it takes effect June 27th. I said 68 days from now. It's actually about 14 days from now. Now, what about the X waiver requirements in New Jersey? Understand that if you administer opioid treatment programs, there are rules in the states. You're going to have to follow. You have to test, and you have to get a waiver from the state in order to do this. So you can't just automatically start treating substance abuse disorder patients in the state of New Jersey. You do have a PDMP requirement. New Jersey, you launched it in 2012. There are about 60 to 70,000. There's 60 or 70,000 patients that are being looked up each month. There is also a project for medical disposal for disposing drugs, and I recommend that you read the pages they have here. And again, these slides will be made available after the conference. When do you use the PDMP in New Jersey? It's for first time you see a patient that is that's using for acute or chronic pain, that's using opioids for acute or chronic pain. The first time you see someone that prescribes a benzodiazepine, if the practitioner has a reasonable belief that the person is seeking a controlled dangerous substance for any purpose, you should look them up in the PDMP. Any time the practitioner prescribes Schedule II in the emergency department has to be looked up. And then on a quarterly basis, if someone is coming for renewal of a controlled substance, then you need that is in an opioid or other dangerous substance listed in the state, and you have to look them up. This is what it looks like. You just look them up. You see what pharmacy they went to. Also, that's for DPDMPs. In addition, the DEA registration has location questions. I put this in there because if you're renewing your DEA license, don't ever use your home address, because unless you want the DEA to come in and do an inspection at your house, your significant other may not appreciate that. The rest of your family may not like that one. But and then also, if you hold multiple licenses in multiple states, let's say you're in northern New Jersey and you practice in you also have a license in New York, or you have a license in Connecticut, or you're in Southern New Jersey, and you have a license in Pennsylvania, and you have multiple DEA licenses, note that you only have to take this course for the one time you have that DEA license. So it's not like you have to take it. It's not like you have to take it for every every time. You just basically have to meet this requirement one time, and it covers all your licenses, regardless of how many DEA licenses you have. The cost for prescribing for a DEA license is about $888 a year. Again, if you're working in multiple states, you have to have multiple licenses, but this requirement is only a one-time requirement, and it applies to all. You should note that the states that any person knowingly or intentionally furnishes false or fraudulent information in their application, including attesting that you've completed a course, has serious penalties involved. This is the Department of Justice that this is a regulation from, not HHS. So this is a DOJ. DEA is part of the Department of Justice. So understand that this is a serious, this is a different level than dealing with an HHS violation. In addition, also DEA has stated that subject to a routine audit or complaint, a prescriber may have to demonstrate proof of having meeting this requirement. So what about the Medical Society of New Jersey course? It's an 8-hour course to meet those requirements. It can be taken online. Right now it's available. We have it available in 2 options. You can do it slide and audio or print and slides. In addition, we also have weekend seminars. Right now we have 2 scheduled, but we'll be scheduling them on a monthly basis. So you can, if you wanted just to take it all at once and, sit down and take it on a weekend, you can, we have these Saturday seminars that are available. Credit includes ACCME, AAFP, AAPA, AAMP. We have right now board certification for ABIM, but we should have in the next day or two, in the next week or two, all the rest of the boards also. We've applied to 21 different specialty boards. It's also an MIPS improvement activity. So if you're in the quality payment program and you're using MIPS, this can be counted as an improvement activity. Actually, anything you do in opioids can be counted as an improvement activity. And there's and if you wanted more information, my contact's at the end, and I can walk you through how you can put together and meet basically all your improvement activities just by doing SBIR screening, brief intervention, or referral, and doing this program plus some other pieces. And also, again, it meets the New Jersey board requirements. This is the program agenda. Again, our program, we cover principal, the Medical Society of New Jersey program covers controlled substance prescribing, risk mitigation strategies for controlled substances, the basics of pain management, managing opioid therapy and substance abuse disorders, opioid use disorder, alcohol use disorder, tobacco and cannabis use disorder, and also stimulant and sedative use disorder. We're starting to see more and more different types of use disorders. And so again, this was about tackling the purpose of the MAID Act was to tackle substance abuse overall, to try to see what we can do to get kind of to see if maybe by training the healthcare professionals across the country, we can make a big difference on this trend. To join the program, this is our resource center that we have. It's clinicaloptions.com, and I'll put that in the chat. In addition, there's course registration. We have frequently asked questions. We have links to websites and with patient materials on this DEA resource center. We also have, once you're in there, if you wanted to take a course, they have, again, links to the on-demand course and the live webinars. Just basically you can go in and just press the learn more button. There are discounts available to non-New Jersey state medical. There are discounts to both members and non-members of the Medical Society of New Jersey. The member code for $50 off for non-members is MSNNJ50. or if it's for the live webinar is MSNHK Web 50. And then members you can contact for greater discounts from the Medical Society of New Jersey. And I highly, highly recommend that you do that. And they've sent it out, I believe, to their members, but if you have any questions, they're more than welcome to give you the access code to get in and save yourself some additional, significantly additional discount. There's a couple of tips when you enter. There's a tech support is available on the site. So if you have any questions, there's just like on our website, there's a little like question box up there. And then also, and if you have, and your certificates can be easily found just by pressing your initials up on the right-hand side at any time. If you want to see what the progress that you've made, or, if you need to find a certificate to be able to present to New Jersey or to have for the feds, and just to put them in for your records. Also, the state of New Jersey, the Medical Society in Jersey will have copies of your transcript. So if you needed it from them, they'll have it as well. These are some additional areas that you can get information on. The DEA notice is here, the clinicaloptions.com clinical DEA facts we have. In addition, there's some policy and medicine articles that have been written about the MAID Act, and I highly recommend that you go on and just and also on the MAD Act too. So you can kind of see the answers for this. And so let's go ahead to questions in the chat. So
Tom, I see a number of them in there. I mean,
you want to go ahead and handle those for me, Larry?
Yeah, I can do a few of them. Let me see if I can pull them up real quick. So let me go for from the top to the bottom. Are physicians required to have a DEA license? They don't write for any narcotics. So you don't need a CDS license or a DEA license if you don't want to write scheduled drugs. But if you do, and it's part of your practice, then yes, you need to have both the federal and the state licenses to do so. And as Tom mentioned in his remarks, if you're multiply licensed, you're going to need multiple DEA licenses and whatever state requirements are there. The second one is the course required for current DEA license holders?
So
limited
on your renewal, you'll have to this is required on your renewal.
Yeah. There was another question down, can I just, it was from Dr. Finelli. If I already have the 8 hours CME, do you have to wait till your next DEA renewal, or can you send it in now? So what's going to happen is when you apply for your renewal, there's going to be a question on your renewal that says, do you have this training within the past 5 years? And you need to be able to answer and attest to that question truthfully at that time. I don't think you can say, hey, I have some stuff that was over 5 years old and stuff that was within 5 years. It's got to be 8 hours, and we're interpreting that to be within the 5-year time frame that that the legislation put out for other training. So I would recommend that you be able to answer that question truthfully when your renewal comes up. So knowing that that renews every 3 years, the DEA, you could take the full course now and be able to answer that truthfully. I don't know what your existing CME would age out, but that's up to the individual applicant to determine. Then I see a question here about does the DEA course have a quiz that needs to be passed for credit? Tom, I don't know if maybe you could take that.
Well, our course does have questions after each module. I don't know if it's on a pass fail. I know I took it. Yes, I took a couple modules yesterday and I passed them. But I just followed through. So, but I don't know what the exact number is but even if you failed, it would just ask you just to, give you the rationale for the question and ask you to take it again.
And I just see one that popped up here. Someone recently renewed their DEA license, but didn't find the question. I think you said it was kind of not operable yet, but it will be on the 27th.
Right, and I saw another question came in from someone that said if their DEA license was renewed in April, do I have 3 years to take the course? Yes, you do. I would just say you might want to take it before April of 2026, just so that you don't forget. It's one of those it's one of those things. Right now people are thinking about it, and then over time you might get busy, and so I would just say you may want to just take it sooner rather than later. Also, we don't know, but I know in one area in oncology, in another state, some hospitals are asking, have you done this? So they're just wanting to get it out of the way. So it just depends on your on the health plans that you work with, maybe asking for this as well.
Yeah, so my on a timing thing, you don't want to get to the last minute when you're and do this kind of as a crisis, but we do have stuff online for you if you are in that situation, and that's one of the things that Tom and I discussed when we put this together, is in multiple formats for people that learn differently. So there's a number of different ways you can get the education, from a full day seminar to kind of on demand. So just think about your learning style and your requirements as you look at your renewal date. Do we have another one that came in here?
Yeah, I see.
Does it matter that when you took the 8-hour buprenorphine course?
So, and actually I see there's two different questions on that one. Yes, yes and no. So think about it. If you took something more than 5 years ago, is it still clinically relevant? And if, as long as you still have records of it, it technically probably could count, as long as you had records that you took the course from 5 years ago or more. But I would say that if you is, again, part of this is how do you stay current, and things change over time. So I would just recommend that you try to, as a rule of thumb, just keep to a 5-year principle on things, because that's what, and again, they haven't really come out one way or another on this. So, but they have stated that 5 years of medical school training. So I don't know exactly the answer on that one.
Yeah, it's a good question on the X waiver, because we've said that the X waiver folks who've achieved that are exempted. I'm trying to think if it said within the last 5 years or not, if there's a time frame on that. I think we'd have to get back to everyone on that. I'm not sure off the top of my head about that. Is it relevant to any DEA license holder, including pediatrics? So anybody who's going to be applying or renewing for the DEA authority to prescribe is going to have to attest under penalty of, you saw the penalties, 4 years imprisonment and fines if you're deemed not to be in compliance. So it's relevant to everybody who's a license holder except for veterinarians. I don't see any further ones coming in, or if there's one that we didn't address, if you would just restate it. I think we got to most of them. Timing requirement to timing of requirement to timing a DEA license. I think we covered that. When you apply, you're going to have to be able to truthfully attest that you have 8 hours within the past 5 years. Here it'll be 3 years. Is there a way to see this presentation over again? I know we recorded it. Tom, do you?
Yeah, we'll make it. I'll edit it and send it back over. I'll send it back over to you.
Great, and we'll also make the slides available.
Yeah, the slides will be available.
And we'll put that up on msnj.org, and we'll put that where you can apply for the course. So if you're there reviewing it and you think you want to sign up, you can do that at that point. I think, the AMA, there are going to be similar course offerings from others, but mainly what I've seen is that they are combinations of already produced material and not specifically developed for this requirements. That's the kind of differential here, is we've developed this material to meet what the legislative language has put out and what SAMHSA has put out in terms of how they're going to be looking at whether you're compliant or not. If your hospital or someone else has a series of courses they're cobbling together, we can't guarantee that those are going to be sufficient if you're audited, but they may be. The AMA has a few materials through their Ed Hub that also will meet the requirements, but we haven't had any review of those or whether they're compliant with the Act. You have to ask the AMA that.
I see someone here says each state has a mandatory opioid courses, so we can add them together and make it up. Again, this is about substance abuse disorder, less about opioids. So I would say that it's sort of a yes and no. What some people, like we're working with several states that have 5-hour requirements, for instance, on the state requirement, but they don't really have substance abuse disorder. So I guess technically you could do that, but I think you got to ask yourself, is this about substance abuse disorder? Because everything they write about is on substance abuse disorder. The only exemption they gave was for dental pain. So unless you're a dentist, that was kind of an interesting way they laid it out.
Well, thank you very much, everyone, for joining. If you have questions that come up to you after the course, we'd be happy to entertain those questions and clarify anything. And we'll if you have more information on the course in terms of the total cost, that's all on the MSNJ website at msnj.org. I'm sure Melissa will have one of our front-facing tiles with this information on it, so you'll be able to go there and easily navigate to that point.